All right, let's dive into a topic that so many of us deal with, knee osteoarthritis. If you've ever felt that ache, that stiffness, or just wondered what's going on with your knees, this is for you. We're going to break it all down and map out the options step by step. You know how it starts. Maybe it's a little twinge getting out of a chair. But before you know it, that pain is kind of running the show. It messes with your sleep, makes a trip to the grocery store feel like a marathon. Heck, it can even take the fun out of a simple walk. If that sounds at all familiar, stick around. We're about to get into what's happening and what you can actually do about it. So, what is osteoarthritis, or OA, really? Well, imagine the smooth, slippery cartilage on the ends of your bones as like the tread on a tire. OA is what happens when that tread starts to wear thin. Eventually, you can get bone rubbing on bone, and that's what causes the pain, the stiffness, and the swelling. It's easily the most common kind of arthritis out there. Now, to really get a handle on this, we've got to look at the knee itself. It's not just a simple hinge that goes back and forth. Think of it more like a little apartment with 3 separate rooms, or compartments. And figuring out which room has the problem is, well, it's everything when it comes to treatment. Okay, so here are the 3 compartments. You've got the medial side, that's the inside of your knee, the lateral side, that's the outside, and then the patellofemoral compartment, which is right behind your kneecap. Now, if there's one thing to remember here, it's that the medial compartment, the inner side, is by far the most common place for that wear and tear to show up. So how do we figure out which compartment is causing all the trouble? You might think it's all down to a fancy x-ray, but the truth is, the diagnostic process is much more personal than that. It's really about your story. A massive clue, and I mean a huge one, comes from just looking at how you stand. If someone's a bit bow-legged, doctors have a fancy term for it, varus, all that pressure is getting funneled onto the inner or medial part of the knee. And on the flip side, if someone is knock-kneed or valgus, the stress goes to the outer, lateral compartment. Your body's alignment tells a huge part of the story before we even see an x-ray. But here's the thing, and this is so important. You can have an x-ray that looks like a total mess, but you feel basically fine. And the opposite can be true too. Terrible pain, but the x-ray doesn't look so bad. That's why the pictures are only one piece of the puzzle. The real diagnosis is about how this is actually affecting your life. And this quote from orthopedic surgeon Paul Tricker just nails it, doesn't it? It's not really about the cartilage. It's about the quality of your life. When something that should be a simple pleasure, like getting the Sunday paper, starts to feel like a dreaded task, that's when we know we have a problem that needs a solution. Your story is the most important tool we have. Okay, so let's talk about what we can do about it. Long before surgery is even on the table, there's a set of really powerful foundational steps. And these aren't just vague suggestions. According to official guidelines, like the NICE guidelines in the UK, these are the absolute core of managing knee OA. These are the big 3, the non-negotiables. First up, exercise. The right kind of movement is literally medicine for an arthritic joint. Second, getting specific with strengthening and stretching the muscles around the knee to build up a support system. And third, weight management. You know, every single pound of body weight you lose takes about 4 pounds of pressure off your knee. These 3 things are what put you in the driver's seat. And beyond those core 3, you've got other tools in the toolbox. Things like painkillers, anti-inflammatory gels. They can help you manage the day-to-day. But what about steroid injections? Well, think of them less as a long-term fix and more like a circuit breaker. When the knee gets really angry and inflamed, it's too painful to do those crucial exercises. An injection can calm everything down, break that pain cycle, and let you get back to the strengthening and stretching that really makes a long-term difference. I love this piece of advice from the surgeon in our source material. It's a little counterintuitive, but it's brilliant. If you have an acute injury, like a torn ligament, yeah, you want to be at the front of the line to get it fixed. But for a worn-out arthritic joint, you actually want to be at the back of the queue for surgery. Give all these other treatments a real, honest shot first. It's the best thing you can do. But okay, what happens when you've done all that and it's still not enough to give you your life back? Well, that's when we open up the surgical toolbox. And it's not a one-size-fits-all thing. It's much more like an a la carte menu, where the right choice is completely tailored to you, your lifestyle, and your knee's specific pattern of wear. So let's walk through the main options on that menu. First, you have an osteotomy. This is pretty cool. It's a joint-preserving surgery where the bone is realigned to shift your body weight off the damaged part of the knee. It's a great option for younger, more active folks.
Then there's a partial replacement. It does exactly what it says. It only replaces the one worn-out compartment. And crucially, it leaves all your natural ligaments intact. And finally, there's the total knee replacement. This is what we call a joint sacrificing procedure, replacing all three compartments. It's the go-to solution when the arthritis is widespread and advanced.
So the big takeaway here is that the choice between these options is absolutely not random. It all comes down to you, your age, how active you are, the alignment of your leg, and exactly where that wear and tear is located. The whole goal is to match the right tool to the right person for the right problem. Now for our last section, and this might be the most important one. Let's get real for a minute and talk about results. We hear about knee replacements being miracle cures, but it is so important to have a clear, honest picture of what the outcomes really look like. And look, for the vast majority of people, it really is a fantastic, life-changing operation. The data shows that about 80%, that's 4 out of every 5 patients, are satisfied with their total knee replacement. That's a really high success rate in any field of medicine. However, that leaves 1 in 5 people, and that's a very real number. 1 in 5 patients might feel dissatisfied, and it's not always because something went wrong surgically. For a lot of people in that group, the new knee just never feels quite normal. It doesn't feel like it belongs to them, and it just doesn't meet the high expectations they had. And that 1 in 5 statistic brings us right back to the beginning, doesn't it? This is exactly why that advice to be at the back of the queue for surgery is so smart. By trying everything else first, by getting as strong as you can beforehand, you give yourself the absolute best possible shot of landing in that happy, satisfied 80%. So, we'll leave you with this question to think about. No matter where you are on this journey, whether you're just starting to notice some pain or you're considering your options, the most important thing is that your plan is built for you. It has to be tailored to your life, your body, and your goals. What do you want to get back to doing? That's the question that should guide every single decision. Thanks for tuning in.